Okay. All right, so we're gonna do a dental cleaning here, at least part of it, and I'm gonna demonstrate the different manual tools, and then we'll probably do a separate video with the ultrasonic scaler. But to start here, our dog has a lot of buildup, lots of tartar and plaque. So I'm gonna start here with the tartar forceps, tartar remover forceps. And what you have to be careful of, well, first I might not do this on like a tooth that had a smaller amount of plaque, but here I'm just going to gently kind of place this and just break off some of those bigger deposits. Being careful to not, this isn't about like using force to pry it off. This is about letting the tool do the work to just kind of scrape it loose. This dog has a lot of gum recession, so there is going to be some bleeding probably. But all I'm doing with this is trying to get the majority, these big deposits off. And a little bit here. And ooh, that tooth is very loose. So I'm not even gonna really mess with that one at this time. Pull a little bit here. There we go. And we don't have a ton here. That little bit I can move with the manual tool. I'm gonna try a little bit more off. This tool is oddly satisfying. All right, so the rest of this I'm gonna work on with the manual scaler. From here, I'm gonna check some I'm gonna measure the pockets with my periodontal probe. So the probe has little indicators here, millimeter marks, to be able to test how deep the pocket is. So I want to be careful to like just stick it in until I feel resistance. And again, there's going to be gum bleeding because this dog has a lot of stuff going on. So that's measuring at about 2 mils, 2 to 3 through there, almost 4. 2 to 3 is fairly normal, although again, this dog has a ton of recession, so that's not great, but just measuring it down along through here, even up to 4 there. 4 is pretty deep for a dog. It's actually too deep technically. Dogs, it should be 2 to 3 mils. Cats would be like 1 to 2. So we would definitely mark the pockets as being pretty deep in this dog. I'm not even gonna measure that loose one. Here again, we're up to like 3, almost 4 for most of this tooth. And this would be something that normally, you know, I'd measure a tooth, mark it on the chart, measure the next tooth, or, you know, go down through and just make notes of like extra big ones. Yeah, that one's like 5. Lots of big pockets. All right, so that's how we would use this tool. The next one that I'm gonna use here is gonna be a curette. This curette scaler is actually, I'm gonna be using under the subgingival pockets. And so as I go in through here, I'm gonna kind of keep it in alignment and just using it to scrape. You get the video? Mm-hmm. Using it to remove some of this calculus that's right up here at the gums. And this is for mostly, again, kind of getting what's up under the gum. There we go. Got a little bit of gauze here. And I'm gonna come even up here. I'll demonstrate a little bit here. I don't know if you're able to see, but I'm able to like pull out deposits that are under the gum and kind of pull that loose, because I'm not going to take the ultrasonic scaler up under the gum. There we go. That's how we're going to use that tool. And then for the sickle scaler here as well, or shepherd's hook. This one's going to be more, let's see here. So actually, I'm gonna come back here to the probe because I forgot the other side. So the one side we have the periodontal probe, other side we have the shepherd's hook. And this one is for really good for finding like dental pockets or like cavities. It's great for like feeling around even in between different teeth if I need to. And honestly, there's so much calculus here that I want to just go and clean it. But I can reach in between teeth, or again, if there's little cavities or things like that. And then for the sickle scaler, this one is going to be a bit more for like the predominant portions of the teeth, like so, that I could, you know, scrape off large bits of plaque or tartar. So, and honestly, I'm not going to scrape at it too hard because my scaler is going to get a lot of that up in there. It's going to get all that a lot easier here. But I want to be careful to not take, obviously not to use my tool. Like there's a sharp cutting edge on this that I'm able to kind of scrape along the tooth and remove the plaque. I wouldn't want to take the pick and be like scraping it into the tooth or causing, you know, deep grooves. So I'm going to pause here with the manual tools and we'll come back with the ultrasonic scaler in a minute.